Across Texas, cities are grappling with a growing shortage of doctors. And here in Nueces County, the need for healthcare professionals continues to rise. But for many positions, they remain unfilled. And in response to this crisis, two local lawmakers are stepping up with a pair of new bills to address the shortage, not just in our area, but statewide. Our Lydia Herrera has more on how these bills could make a real difference in our community.
I spoke with Nueces County Hospital District Administrator who says the doctor shortage in several specialties could double by 2030, but he believes either bill could help address the issue. In fall 2023, the Nueces County Hospital District was faced with possibly losing a resident's medical training program. Johnny Hip with the NCHD says as a result of this, they agreed with Krista Spahn to do a physician needs assessment to see what the needs were in the community.
And as a result of that, we've learned that there are other residency programs that need to be beefed up, and there are also physician specialties in the community that need to be worked on in terms of retaining or recruiting additional physicians.
In Nueces County, the largest specialty deficits are seen in primary care and medical subspecialties such as family practice, internal medicine, obstetrics, and gynecology, dermatology, neurology, and psychiatry.
Positions that would probably need to be filled in our community by 2030, and that seems like a lot of numbers, but where we're starting from, we're already in a deficit. So it's sort of, we're building on top of a deficit that's already there.
Hip says for the first time, the doctor shortage is being directly addressed through legislation. Two separate bills, Senate Bill 2666 and House Bill 4801, have been introduced by Senator Juan Chuy Hinojosa and Representative Denise Villalobos. It will provide grant funding for hospital districts.
The funds to be able to create and fund general medical education residency slots, also to be able to work with the hospitals to retain doctors, but just as important, try to recruit doctors who have a certain specialties which are in short supply in Nueces County.
And in the next 7 years, it will increase to 10,000. We're struggling at the moment to recruit doctors to our area. This grant program will greatly help with that, giving them competitive pay. And we need to close the gap as soon as we can now for the citizens living in our districts.
Hip says the hospital district is currently unsure of how much funding will be allocated if either bill is passed. However, they are hopeful that once the bills are approved, hospitals in need of funding for specific medical specialty positions will be able to apply for grants through the Nueces County Hospital District's program. Back to you.